most famous physical therapist on the internet.
Have you
Hi,
done
folks.
it?
I'm Shop Physical Therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So we were just debating which massage heads we're going to use.
Yeah.
So how to use a massage gun for low back pain relief. Now, when you're going to start massaging the low back, the easiest area to start in is to focus on the muscles that are closest to the spine. I want to show that right here, Brad.
Sure.
So this is the lumbar spine, in the low back.
Right. Here.
And there are layers upon layers of kind of stringy muscles that run right close to the spine. The spine is right here. The bumps you feel in the back of your back, your low back. I would go ahead and just start hitting right along the muscle group here. So if we look at this spine right here, you can see again the spinous processes, and there's muscles that are filling in this area here.
So we're going to go here or here.
Yeah, staying off the bone.
But not on those bumps.
Right. Now, we do have a massage head that actually is a field goal, and you can actually go along like that. I actually, Brad, believe it or not, I do use this one sometimes on my calf. If you go along with the muscle fibers.
So you're going like this?
Yeah, it's just a really good deep massage.
Right. Yeah, this head is not one you commonly used, but it has its places.
I haven't tried it on my back, so do you want to do it on mine once?
Yeah, because you've got to go across those bones, the spinous processes, those bumps that stick out. You ready for this, Bob?
Yeah, let's see what happens.
So I'm going to work it just like this. Can you see that, Mike? I'm sorry if whoa, you don't want to massage it.
Either side.
All right, so I'm going to first feel where the bumps are. I don't know if you want to turn all the way around so we can show the people more clearly. All right.
How's that?
So here we are. I can feel the bumps right there. I'm going to make sure I bridge across those because these are plastic. It's a harder surface, and that would not be comfortable on those bones. Are you doing okay with that,
Yeah,
Bob?
it actually feels good.
Ah, good. Now, if I go right to left a little bit, am I getting closer?
Still fine.
It's doing okay?
Yeah.
Okay. So I've got it at an angle. If I go more direct in, it's going to be a little deeper. Now, this is something obviously Bob cannot do to himself.
Right.
It's going to have to be done someone else. So you really have to listen to their feedback. If they say ouch or stop, please be respectful.
Brad, why don't you take the pointer one and do it on my back too, and I want to see how that feels compared to that.
Sure.
So the pointer one, it looks kind of like a bullet.
Yeah. So this is the pointer on our smaller gun, and this is the pointer on our little bit larger guns.
Right.
So again, these really are quick to take on and put off.
And these are small guns, but they're very powerful. This is our smallest gun, but it really is powerful.
Yeah, you have to hold the button down for 2 to 3 seconds before they turn on. So I'm going to pull this so you can see it better. And so I'm working here, and I can go in. I'm going to work that whole muscle group that goes up and down on each side of the spine. And then down in the lower back, there's even more muscles. We've got the quadratus lumborum, the supraspinatus, or what's the big long group of muscles you just
That's
touched?
right.
What is it called?
Well, which one? The spinalis? I don't know what you're talking about.
The whole big muscle group.
Paraspinals?
Paraspinals.
There we go.
That just, you don't, that way if you just say that, you don't
Yeah,
have to
you
name
don't
them
have to
all
say
out.
name them all.
It's the whole group that
There's
goes
small little muscles, rotators, and so that one, I would say this one was more aggressive. And if you want to go less aggressive, you can go to air-filled one.
Sure.
So if you want to go with a less aggressive head, the air-filled really works well for that. It's probably the least aggressive head. You could go over bones with that and it wouldn't be too bad.
Yeah, it's a little squishy. You got the round head.
Round head
may
sometimes can work all right,
Mm-hmm.
and even the flat head might work for that area.
Yeah.
That's a more aggressive one. It's metal.
Yeah, that's
for
for the real beefy
big
guys
gun.
with the big gun, yeah.
Yeah. All right. Now, in addition to doing those muscles that are on directly by the spine, we're also going to look at. I want you to look at the anatomy here. This is really interesting. This is a picture of Brad with his skin off.
Right. Yeah. Look at that. So I got crosshairs on my back. What do we got there? The lumbar fascia.
Yep, the lumbar fascia. So
The-
that white part,
Yeah.
yeah, is the fascia. And what you can see is what I want to point out here is, and here I got the wrong color again, Brad. So
Well, let's see how it looks. This is our new toy.
yeah, so what I want to point out here is actually the latissimus dorsi attaching to the fascia.
Mm-hmm.
Both sides, of course, and the gluteus maximus also attaches to the fascia.
Right.
So you may, as a secondary thing, if those are tight, they could be pulling on your back, and you're not able to straighten your back as much as you would like.
Yeah.
So you may want to massage those areas too. You know.
Yeah. So we're talking, way up in here is going to have some effect on that fascia as well as these muscles because they all go in and they connect. It's kind of like, well, it is really a belt.
Yeah, it is like
a low
nature's
back belt.
Yeah, a low back belt, and that's why you also want these strong.
Sure.
But you also don't want them painful.
Right.
And weak.
Right.
So you can take a massage to those areas, Brad. Do you want to? You can, and those are big muscles, except for the latissimus is next to the ribs for part of it. So you probably want to go with a flat head for that.
Yeah, if you're doing the latissimus, you're probably going to do this lying down,
Yeah, right.
so that it's a little easier. You work that.
Now the buttock is one area you can work. That's definitely one you can get to.
Yeah, I usually do this. I like to put one foot up. It just seems to be more comfortable for me. Ooh,
You can lie on
yes.
your side too, but
Yeah.
you can also use the handheld massager, Brad. The white one on the
Oh,
floor.
I'm sorry.
This one's not nearly as powerful, but it's less expensive. But it's also with the handle like it is, you can reach areas a lot easier.
Right. Yep. Get back in there. Here you can get up into the lats, work your way down into that
Lumbar fascia.
Yep, the lumbar fascia, the hip.
I wanted to prove, Brad, by the way, that this is you, strong like balls.
Oh
See?
my goodness! Yeah, look at that. Wow.
That's definitely Brad.
I don't even think I looked like that when I was young and strong, or what? Maybe I wasn't. I'm not sure, but whatever.
Yeah.
It makes me feel good, anyways.
All right, remember this video is a part of a series of videos on massage. We show you how to massage every pain away from your body.
That's right. Which head to use, what muscle group to hit so that you're complete. You can go to bobandbrad.com, go to the massage button, click on that.
Go to programs.
Programs,
section,
there you go.
And under the programs, you'll find the one for massage gun.
Right. Look under there. There'll be numerous titles with thumbnails attached. Click the one that pertains to your problem. Watch the video, and then click on the PDF printout so you get a printout, a review of the whole video, and you have it right in front of you so you don't have to go back and look at us anymore. The whole thing is absolutely free.
Right. Get your credit card out and throw it away because you won't need it.
Not even an email.
Not even an email.
Yep.
We're just it's our gift from Brad and Bob.
In case you can't remember your email.
Oh, that's true.
Right. That could be me.
Very likely. All right. Thanks, guys.